Where do people get information about this? Is it all online or?
One of the best places to go, I mean, as a cardiologist, obviously I'm a little bit biased, but would be the American Heart Association. You go to the American Heart Association or the AHA.org. That's a great place to get information on this. Again, I think you want to keep it simple and knowing the salt content of food. For example, here in New York City, the average slice of pizza has somewhere between 1,000 and 1,500 milligrams of salt. Well, if you're saying I can only have 2,500 milligrams of salt per day,
you're done.
One slice of pizza, and you've consumed almost half, if not more, of your daily salt intake. That's a really important thing because remember the consequences of high blood pressure. We've been talking about high blood pressure as a number, but I think it's a big deal because what people don't realize is that it leads to other things.
What does high blood pressure do to you? So for someone who's watching this and say, okay, so what? So my blood pressure is up a little bit. What does that's the forced pressure, the pressure behind the blood that's going through your vessels. So what does that actually do physically in your body?
Right. Well, it's kind of funny. I'll tell you, I took my practice over from my father and my grandfather. And when I first came into the office, I came in thinking I knew all these wonderful things. I trained under great people. But I've learned more from the people that I've been taking care of over the years than anybody else. And the older patients used to say to me, Adam, your grandfather never hurt me. Your dad never hurt me. You better not ever hurt me. And I sat there and did the math and I said, when my grandfather took care of you were 20, my dad took care of you 50, now you're 80. Something could happen while I'm taking care of you.
You have the tougher job.
I do have the tougher job. I'm the anchor man. But you ask about the damage. So over a long period of time, as the heart pumps, when it squeezes, that's the top number, the 130.
Systolic.
Systolic. When the heart relaxes, that's the bottom number, or the diastolic. With each pump of the heart, say your heart beats 60 times a minute. With each pump, the force of the blood leaving the heart and hitting the wall of the artery can cause damage to the artery. Whether it's in the arteries of the heart, the arteries of the brain, the arteries of the eyes, the kidneys, the legs, anywhere in the body that pressure is hitting the wall of the artery, over time, it can develop atherosclerosis. Those are the damaging processes that lead to plaques and can cause heart attack, stroke, loss of vision, kidney failure, and peripheral vascular disease.
Absolute disaster. Before we get to that, because we're going to come, it's amazing how fast time goes. But I have an email, and before you came, we actually talked about this on social media.